As you know, my home state of Washington was the first to experience a coronavirus case back in January. We're now looking at 9 deaths in the state of Washington. I am incredibly proud of our state's first responders, public health officials, and infrastructure that's been built, and the tremendous efforts and work that they have put forward. I do have to tell you that the response efforts have resulted in an estimated $200,000 a week of unexpected costs in Seattle and King County alone. People on the front lines, including health workers and emergency service personnel, were not provided with adequate personal protective equipment in advance, and the initial botched test kits and the slow response from the administration on testing protocols were incredibly detrimental to our efforts. In fact, Washington State is still waiting for half of the requested medical supplies for response efforts. Calling this a hoax, as President Trump did in the early days of this virus, was extremely damaging, and taking just $2.5 billion from other needed sources as the administration's initial response to this was simply not sufficient. Thanks to appropriators, we will hopefully have an $8 billion plus package that we will pass through the House, but it is time, Mr. Deputy Secretary, to stop playing politics with this. We are losing people's lives as a result. What about the administration's public charge rule that has created a chilling effect for people to come in and seek care? Are you telling the Department of Homeland Security and the administration that that is not helping to contain what may be an impending pandemic that would affect every American, not just those Americans who don't seek that care?
I would have to defer questions on that rule to the Department of Homeland Security.
But don't you think that's important as a public health official, the Deputy Secretary of the Department of Public Health, to ensure that people do not face those barriers if they are experiencing those protocols?
Any local decision about how someone responds and gets care is, obviously that's a matter of public health import. However, any questions about the particular rule should go to Homeland Security.
I would hope that you would let the Department of Homeland Security know that this is a public health issue for all Americans, that people do not seek care because they are afraid that they're going to be deported the next day or seen as a public charge. Mr. Deputy Secretary, some individuals have gotten tested, found that they are tested negative, and now they owe over thousands of dollars in medical bills. In a healthcare system in which 70 million people are uninsured or underinsured, and which over 500,000 people are declaring bankruptcy every year due to medical bills, what is your plan to work with insurance companies, pharmaceutical companies, and hospitals to make sure that people don't go home with bills that may bankrupt them?
We do maintain support for the ACA exchanges that provide insurance on the exchanges. We have many options and choices that are available in this country for people to finance their care. We also provide increased support to community health centers. We're very supportive of them. They provide care for many millions of Americans at reduced cost, and they're available in communities around this country.
You are aware that as the ranking member has undermined the Medicare for All bill, which would provide universal health care for everybody, the Trump administration has worked very hard to cut the care that's provided under the Affordable Care Act. I hope you're aware of that. It has serious implications now during this time of crisis for many people across my state and frankly across the country.